Welcome to this brief webinar explaining Sollite Integrative Medicine with Reverend Dr. Anthusa Helena. Some of my background professional consulting work services. In the olden days, the hospitals did not have wellness centers. And so I helped implement it in South Florida, 3 hospitals, JFK, North Broward Regional, and Imperial Point. Other areas were wellness centers and recovery centers that brought in alternative and complementary integrative techniques. Because our present healthcare system only treats symptoms, never addressing the core problematic issues, very seldomly, spirituality, which facilitates holistic integrative medicine or integration, is much overlooked. And there lacks recognition of Eastern empirically based medicine throughout the systems. So, Sollite Integrative Medicine combines the best of evidence based science, medicine, and spirituality in a holistic medical approach that addresses the entire being on a physical, mental, emotional, energetic, and spiritual realms by treating the person as a whole, not as segmented, symptomatic parts, which helps us find the core cause and issue of the overall problem. Sollite's unique difference. Amongst other fields, I have an extensive education in bioscience, which is the human bioenergy field. Also studied and interned with world-renowned medical intuitive. Personally have, since I was very young age, now about 6 or 7 decades, have worked with and lived with 54-degree angle S-curve scoliosis personally, experiencing levels of lifelong pain. My thesis in my master's degree program was in neuropsychology research on the areas in the brain centers that hold trauma, emotions, and belief systems that keep us re-looping in the same cycle of a endless story of trauma. Also, my specialty in head trauma and spinal cord injury rehabilitation center helped with the research years long in the neuropsychology department. My main focus in Sollite is changing your mindset on pain. You can look at these 2 articles that are blogs, but also videos on YouTube as well. First, there will be times of pain, but suffering is optional. Second, so what can I learn from each bit of suffering if? And the blogs and videos correspondingly are, who is it that is suffering, and how pain and suffering can be transformed. Other resources are my YouTube channel, which has over 200 of educational resources. Video series found on my website, emotions, common ones, fear, anger, grief, and a self-care series, as well as free gifts. Levels of pain that we are addressing are looked at on the physical, mental, emotional, energetic, and spiritual. And the core cause can be lodged in any of these realms. Shifting trauma through integration. I've co-authored a book called While We Were Silent, considered with other 12 experts that shared their stories on healing trauma and being an expert in helping others with trauma, and especially in the areas of chronic pain, which also cause stress, anxiety. And medically, when it lasts beyond 6 months, it is considered post-traumatic stress disorder. My chapter in this book actually explains how offering integrative, holistic psychotherapy is an avenue for healing. My hub is my website, and like I said, the book can be found on Amazon author page. You can also view an interview on that page of what's copied in that book, the YouTube channel, Facebook business page, and also on Facebook is a private group that supports a self-study program on meditation called Pause for Peace. How we do this, integrate, is we use the roadmap to recovery through integrating body, mind, and spirit, addressing first the trauma and chronic pain, then regulating your nervous system, then teaching you how to listen to your body's inner wisdom for continued self-care on your own. Testimonials from clients, as written by a psychologist who also studied the integrative medicine program. Clients gain insight, awareness, and mobility more easily. Physical and psychological blockages and traumas that used to take years to release occurs in just a few sessions. Marianne. So Sollite helps clients through education, treatment through sessions, and consulting services. The self-study programs are videos that include also a companion workbook. Pause for Peace, I mentioned before, also has its own Facebook support group. Conscious Counseling teaches you how to use your roadmap of your body to self-discover and inquire about the hidden places where you're holding stored unconscious emotions. Energetic Manifestation is a longer manifestation program. Then Practitioner Training Program is, like I said, explains integrative medicine. It is broken down into two parts in case you're not interested in the whole program. Section on just body, mind, or section on just spirit. Although if you are going to continue to get certified to do the work and study with the mentorship program, you would need to take both segments. The integrative medicine treatment protocol mentorship is one-on-one, where you're actually doing internship and self-study supervision. Private sessions are for people that want to be committed for 3 months to serious, weekly, if not even more often, private session work. So again, just recapping, Sollite Integrative Medicine main focus is targeting chronic pain, which creates stress and anxiety, and if long-term is traumatic, labeled post-traumatic stress disorder. We help you through integrative medicine, comprehensive energy practices, somatic therapy, and spiritual counseling. For more details about Sollite Integrative Medicine, go to sollite.com. Thank you.